Hello, this is Joan Justice with HealthWorks Collective, and I'm here today with Herbert Ong, President and CEO of Healthentic. Healthentic plans to transform wellness in the workplace by gathering data and helping employers better manage their wellness programs. Herbert Ong has a background in healthcare business and information technology, and he co-founded Healthentic with the mission to control healthcare costs and outcomes. Herbert, tell us a little bit about Healthentic and its mission.
Great. Thank you so much, Joan, and I appreciate this opportunity. This is a topic that I'm very passionate about and love anytime we can talk. Healthentic is very passionate about helping employees and people in general to improve their lives for the better. We think that you can do that in two ways. One is using the power of data to really understand who is the folks that are most at risk and needs to have prevention right away. And two, combining that with the power of elegant design. It has to be something that is actually actionable and useful by the people, the employers out there to actually implement programs. So as a company, these are the two things that we focused on. What we have is a product called the Wellness Decision Engine. Mm-hmm. It's a tool that helps employers make decisions on wellness, but for the first time using data. What makes it really different is three things. The first thing is that it's whole health. So we're one of the only companies we know of that not only takes medical data and pharmacy data, we'll take historical claims data, but we also combine it with dental data. We combine it with health risk assessments, biometric data. We have a partnership with IBI to actually do productivity reports. We also have a partnership with Vision and getting vision data in the tool. And we have basically, we're looking at all sorts of data to truly identify the population that's most at risk. We call that whole health. The second thing we do is we go beyond reporting. We interviewed 138 benefit managers in their first year and really try to find out what is their biggest pain points. And beyond the fact that they're already getting all these reports from their medical carrier, dental carrier, their vision carrier, their brokers, consultants, the wellness vendors, they wanted one place to see it. But there's actually 9 steps that employers go through before they see healthier employees and lower costs. Step 1 is the reporting. What is this health status of my employees? But then they need to understand, I asked benefit managers, do you even know today how many people in your company is healthy? Mm-hmm. How many are at risk? How many have a chronic condition? More importantly, do you know the health migration? Do you know who used to be healthy last year and is now at risk of chronic this year? Who's going to be next year's catastrophics? Mm-hmm. If you know the risk migration, more importantly, do you know what was the key clinical drivers that caused that? Because if you have limited time, limited dollars, you want to spend your time on the chronic, the disease, but you also want to focus your time on the people that are getting worse. And what are the key clinical drivers?
And how can you stop it? Yes, of course.
How can you stop it? Once you know that, do you actually know all the different strategies that employers implement to actually address these particular hotspots that you might be having?
So you show them the strategies too.
We have with the strategies, and we actually give them one-click business cases and CO presentations to get approval. That's the number one problem that we found, that many employers who are administrators trying to become wellness, that they can't even get their employers to approve it. We give them these business cases to get approval, and then we give them the actual do-it-yourself material to launch the foundational wellness programs that they need to have in place, like a smoke-free environment or a fruits on the table, but also very specific ones for very specific, medication non-adherence for diabetics, chronic kidney disease. Once you actually know that, do you actually know the wellness vendors and what your carriers provide as services for you? Mm-hmm. Who are the wellness vendors you would call if you have a problem with smoking cessation? Who are the wellness vendors you would call if it's kidney disease screening?
Okay, so you offer them that too. You offer them wellness vendors, a list of wellness vendors. Great.
Right, and then once you actually implement the program, which is just one of those steps, do you actually have an ability to track the success of that program? The success metrics. Can you course correct, not wait 2 years later to find out whether or not the program worked or not, but actually know every single quarter, every single month, every single week, whether or not your activity metrics, your outcome metrics, your action metrics are all improving or not. So, as a product, what we decided to do is not only whole health, but we go beyond reporting in an elegant design and a very, very now affordable, way that any employer can actually implement this program for all sizes, whether you're fully insured, self-insured, whether or not you have access to data or you don't. We have a version of the product that helps you go through these 9 steps. But the most important thing is that you implement a measurement platform, right? So if you want to lose weight, or I want to lose weight, the first thing we should do is buy a scale and find out where we're at.
The baseline.
Then, right? Then there's like 5 or 8 different kinds of diet programs out there. I might try the caveman diet. You might try the the carbohydrate diet. You might do the Jenny Craig program. We don't know which one of those works for me. But if I have a scale and I figure out what's happening, I can figure out which of those programs are working. And the same thing with you. So as an employer, you need a measurement platform to know what your current baseline is. Then, depending on the population, and everybody's very different, you want to implement a program, but then measure to see if it's working. Is that the right benefit plan design? Is that the right communication strategy? Is that the right incentive or disincentive? Sort of things that you need to know, you need to try and test for different populations. And if you have a program like ours, we can then track to see which is working, and over time we'll figure out which programs work best for your kind of population. So these are real-world outcomes that is able to be tracked by doing whole health and looking at all information at one time.
Great. And how much does it cost? And how do you tell the employers that it reduces their costs?
Okay, so the first thing is that it's now very affordable. All size employers can purchase this product. The Wellness Decision Engine has 2 versions. The Power version is powered by data, and the Spark version where it doesn't need data. So the Spark is available for all size employers, even if you're 30 employees, 50 employees. The Power version is employers typically that is 150 employees and higher. Our sweet spot is the 1,000 to 10,000 employee size, but even jumbo employers are finding significant value in what we're offering as well. We have one price for this. It's $1 per employee per month price, which is very affordable because if you're spending $650 per member per month on your chronics, it behooves you to spend $1 per employee per month just to be able to get a baseline platform and track the success. So the other question you asked was, how do we know this is successful? What I say is that as an employer, you don't just implement one wellness program and expect that it's going to succeed. You should have a suite of programs targeted at a specific hotspot that you've identified. And again, I've mentioned that you want to target the people that are getting worse, the risk migration specific. You don't just do one program, you do a suite of programs. So one example is we found out that this one company had a lot of diabetics. Great. But we found out that they had more diabetic hyperlipidemia comorbidity than they did diabetic hypertension, and they had a lot of diabetic periodontal disease. So for that population, you'll want to implement diet programs, not just hypertension programs. You'll want to implement dental programs, not just diabetic programs as well. So a suite of programs, number 1. 2, do you have the foundational programs in place? It's funny when I hear about employers who implement this health risk assessment, and then you ask them, why was it not successful? And part of the reason is that, well, they hadn't yet implemented a smoke-free environment. They hadn't yet implemented a basic fruits, diet program in the company or exercise program. They haven't had their executives approve and kind of start participating and communicating the importance of wellness to the company. So when then they implement the health risk assessment, it becomes something that the employees think that you're doing for your benefit, not for the employee's benefit. 2, you need to measure success of these programs. So, without these kinds of things in place, it's the likelihood of being successful is not as good.
Yeah. And how many clients do you have at the moment, Herbert?
Great. So, we just launched the company 4 years ago, and we launched the Wellness Decision Engine after extensive interviews with 140 benefit managers the first 2 years. And this year, we now have 40 employers who purchase the product from us. We have 22 brokers and consultants across the nation who are purchasing the product. 90% of the time, they buy it from us and they give it to their employers for free. We have 12 Delta dental plans representing 50 states who are our customers and distributing our products for us. And we have a partnership with a medical carrier today, And we think that that's actually going to grow because men in medical carriers are finding significant value in both of our versions of our product. So we've shown that everybody in the ecosystem is finding something really interesting about what we're offering. And it's really interesting. We actually even have a partnership with 2 wellness vendors as well. And we think that that's going to grow significantly over time as well.
Sounds great. Thank you so much, Herbert. I think you've given our readers a really good idea of what Healthentic can do. And wellness programs and management of health in the workplace are going to become increasingly important. And Healthentic seems like it can really help. Thanks so much.
Thank you, Joe. I appreciate it. And I just remind everybody that this is really personal. There are people that are getting sick, and you can prevent it from happening. And they're your wives, they're your husbands, your friends and family. So it's really important that we solve this problem. Thank you so much, John.
Thank you.